After removing the lungs from the thoracic cavity, we can now examine the lungs in their entirety. Let's look first at the mediastinal surfaces of the right lung and the left lung. Here, it's very clear to see the root of the lung that we mentioned, that we had to cut through to free up the lung from the thoracic cavity. Here is the root of the lung of the left lung. Each lung consists of an upper lobe and an inferior lobe, and those are defined by the oblique fissure. And on the lateral side, I can show you a very nice oblique fissure of the right lung and an oblique fissure in the left lung. In addition, the right lung upper lobe has a horizontal fissure, which then gives us an intermediate lobe, as you can see here. Sometimes these fissures are not as prominent as they are in this particular lung. Nevertheless, they're there, and in this particular one, it's quite prominent. In the left lung, even though they don't have an intermediate lobe, we do talk about a structure that resembles a tongue, and it's in the upper lobe, and it is the lingula right here of the left lung. Now let's look again at the mediastinal surfaces of the lungs. The prominent structures entering the lung, for example, the primary bronchi and the pulmonary arteries, have very specific arrangements with the pulmonary veins that are exiting the lungs. In the right lung, when you look at the root of the lung, we can actually see the primary bronchus right in here, and we can identify it because of the prominent cartilages that it has. I will zoom in now, and I think you can make out the cartilage of the primary bronchi. I did slice the primary bronchi a bit distally, and consequently that's why it resembles more of a fissure than a primary bronchus. This primary bronchus is actually above the pulmonary artery, which is anterior to the bronchi, and in fact we talk about the right primary bronchus as the epiarterial bronchus, that is above the pulmonary artery. The veins are anterior and more inferior than the arteries as shown here. When you look at the content of these bronchi and arteries, the arteries will have clots of blood that I am taking out now, whereas in the bronchi, oftentimes you'll find mucus-like components left behind from either sepsis or aspiration of the patient before death. On the left side, we have the similar structures. We can make out the primary bronchus, and there is the mucus material that we're taking out. And we also have pulmonary arteries. This one is just full of blood that was left inside the pulmonary artery when the patient expired, and it was embalmed, and consequently that's what is there. Inferior here, we would have the pulmonary veins. The objective now is to dissect out the primary bronchi on each lung and see if we can get to a bronchopulmonary segment. The way to dissect the bronchi is to use scissor technique and to separate the tissue, as I am doing here. And it's easier than you might think it is because the cartilage makes the bronchi tougher than the pulmonary arteries and veins. And when I'm actually digging in here, I can feel the cartilage of the bronchus and use that as a guide to free up the bronchus. I will stop filming now and do some more dissection and then get back to the end stages. We have finished removing the lung parenchyma from the bronchi of the left lung. To review, this is the upper lobe of the left lung. This is the lower lobe of the left lung. Here is the primary bronchi that we cut from the mediastinum. Each primary bronchi will then split into a secondary bronchi that goes to a specific lobe. This one is going to the upper lobe. This one is going to the lower lobe. Each secondary bronchi will split into a segmental bronchi, of which I am showing you right here, pointing out to them on the upper lobe. Same thing on the lower lobe, we have secondary bronchi and segmental bronchi. And I know that you cannot appreciate this at this time, but simply by touching the segmental bronchi, you can feel the cartilage within the bronchi itself. We have now moved to the right lung, and again, just a reminder, the primary bronchus was cut close to the lung, and the epiarterial bronchus is the top opening, and the intermediate bronchus is indicated by the lower opening. This is the artery, the vein located anteriorly and inferiorly. We have the upper lobe, the middle lobe, and the inferior lobe. Back here, you can see a nice oblique fissure there and a horizontal fissure here. We will now stop the camera and I will dissect out the bronchial tree in this lung, and then I'll photograph it at the end. I've finished dissecting the bronchial tree in the right lung, and just to review, here's the upper lobe, middle lobe, and inferior lobe. The primary bronchus was right here. I sliced it obliquely when it was in the cadaver. Nevertheless, you can now appreciate the three main secondary bronchi from that primary bronchus, one going to the upper lobe, one going to the middle lobe, and one going to the inferior lobe, as I'm showing here. The secondary bronchi then gave up to segmental bronchi, and here's one and here's another one, and basically to identify these we just would cut through the lung parenchyma like such, and there's a lot of lung tissue that we have to go through to get to the segmental bronchi. And here's one right here going to its termination.